Two humorous nurses would like to acknowledge the true custodians of the land in which we record our podcast, the Yorta Yorta people.
We pay our respects to elders past and present and extend our respects to all Aboriginal and Torres Strait Islanders listening today. Always was, always will be Aboriginal land.
Two humorous nurses with Kelly and Alicia.
The podcast that loves a good bone.
Welcome to Two Humorous Nurses, where we plan to bring you funny, informal, conversational chat about all things nursing.
Today we've got our very first doctor guest. However, Dr. Sarah is no ordinary doctor. She was Miss Inked Australia and New Zealand in 2017, mum to a toddler, a tattoo studio owner, and an orthopaedic registrar.
She's bright and colourful and nothing you would expect from a stereotypical surgeon. Breaking the bias in so many ways. Welcome, Dr. Sarah.
Oh, thank you so much for having me, guys. This is exciting. What an intro. Fabulous. Makes me sound really exciting, but I'm actually really not.
I don't know. One look at your Instagram and I feel like you're pretty excited.
Oh, thank you.
So let's start with when you decided to become a doctor.
Yeah, so I started pretty late actually. I kind of decided when I was about 20 or so that maybe I was interested in the medical industry, but at the time was doing some stuff in dental assisting and kind of the dental side of things, and didn't really think too much about it. But grew up with my old man being a country GP, so I always kind of like looked up to him. And then kind of had a bit of a light bulb moment that, hey, maybe I could do this and, be a clinician and kind of get in and help people and do all the things, and kind of started my application for med school late. But I kind of went in via the undergraduate pathway still. But yeah, started as a mature age student. So that's kind of my journey.
So what was your undergrad?
Yeah, so I didn't do any undergrad university training. My undergrad was through TAFE, so through Adelaide. Yeah, so it was interesting for me because I started medical school in 2013 after having done like TAFE studies for hospitality management and for some dental assisting and oral health type things. And they, at that time, allowed you to apply for medical school as undergraduate, having done TAFE studies without having to go postgrad. So I was like the last year that Adelaide Uni decided to take someone in via that pathway. So I still had to set the undergraduate medical entrance exam, and still had to do the application process for interviews. But it was the last year they allowed you to have like your previous year 12 studies from quite so long ago. Because I finished year 12 in 2005. So or 2005 and 2006, I did it over 2 years. So for me, it was quite a hiatus between training, but was therefore much older than most of my cohort when I started at undergraduate medical school. But being a mature age student.
I feel like you're already inspirational. I'm like, what am I doing?
No, just, I did when I was 18, like I didn't want to be a doctor. Like I was too busy, having fun and doing all the things that teenagers like to do. So it certainly meant that having a bit more life experience by the time I applied, I think that was helpful. Having, not coming straight from school and going straight to medical school was certainly advantageous, you could say, to me, because, you could relate to people a bit more. And also I grew up in the country, so, very different background to most of the people that I studied with. I did all my schooling in a rural school, open access, some of the stuff. Didn't get the opportunity to go to, a private school in the city. I had like 10 people in my year 12 class. It was very small. So very different. Yeah, very different to most. But, I'm glad because it certainly, helped mold who I am today, I guess. So, yeah.
Absolutely. It's interesting that, you say you got in with those undergraduate studies, because in 2008, I was an enrolled nurse and I was looking at transitioning to registered nurse. And I thought, maybe I'll just go and do medicine instead, because I'd sort of always had thought about it. But my grandfather was an orthopedic surgeon, and he was very much women are nurses and men are doctors. So had always encouraged me to be a nurse. And at the time, I had graduated high school in 1995. So I had to redo, and I didn't do like a tertiary entrance exam. We used to call it a TE back then, but I didn't do that. So I would have to go back and do year 12 or a year of some kind of study to get in. And it was going to be a 2.5-year process for me to even get into medicine. And I was like, I'd almost finished my RN by then. So I never did it because I was like, I don't want to sit the GAMSAT. And I was like terrified about it. And I was already 30. So I was like, I'm going to be old. Yeah.
Well, I honestly, like GAMSAT, God, I'm glad I didn't have to do it. That'd be a tough exam to pass. Like, so much respect for people that go and do that. That's amazing. Like I initially even thought, I wanted to pursue dentistry, was another option that I thought as well, like as another avenue. If I couldn't have got into medicine, the plan was kind of, hey, I could go this way and maybe, transition across disciplines if I'd got in, but I wasn't successful in gaining entry to dentistry anyway. So that kind of came off, that work got taken off the cards.
But that's incredible that you even had those thoughts as someone who, was working in a relatively not low skilled, but was your course like 6 months or a year or something to do dental assisting?
So I was it was done over I think it took a couple of years because I was working full-time as a dental assistant and then subsequently clinical coordinator in a country practice anyway, so I had quite a good role that was it was fulfilling and I enjoyed it, and I could have been quite happy doing that. But I was actually quite lucky, and it's quite interesting because I, being from rural background entry, I think that's subsequently what got me my offer into medical school, because they try and get people in from different walks of life to fill, I guess quotas and look good on paper, and like they're trying to diversify and so forth. But I got a very last minute call up. Like they called me because someone pulled out last minute and said, hey, we've got a spot, week starts in 2 weeks, we need to know by the end of tomorrow. So I had to quit my full-time job and find a house in the city within the space of 48 hours. So it was like a very last minute thing for me. To even think about that now is quite scary, to having to make a decision like that. But no, like glad I did, and it all obviously worked out in the end. But it was definitely not a routine entrance for me.
It was meant to be.
Must have been.
Obviously, we're a nursing podcast, and as a doctor, nurses always joke about doctors and junior doctors especially. And I have heard I read a book by another doctor who describes some interactions with nurses as not being the most, pleasant experience maybe when she was a junior doctor. How have you found your interactions with nurses over the years, especially as a junior doctor on the way up?
Yeah, look, I've been really lucky. I've always had good interactions with the nurses on the ward. I think part of that, though, is a lot that from the start, when you go into kind of, day one as a junior doctor, you're flying on your feet, and people say, if you piss off the nurses, it's going to be hard for you, from the get-go. And just realizing that you're actually a team and that everybody is important as one another, and that there shouldn't be this, some doctors think they've got this God complex and that maybe they put themselves on this hierarchical pedestal themselves and, think that they may be better than other people, which I certainly don't. And I certainly respect the fact that nurses often know what they're doing and have been doing it for longer than me. So I've always gone out of my way to, make sure I know who everybody is, introduce yourself and work as a team. And especially in, in the discipline of orthopedics that I work with, the nurses, they're very skilled, especially the pediatric ones in particular. And, people that don't listen or take nurses seriously, probably half the time, if they're having bad interactions, maybe they deserve it. Now, maybe there's a reason why. I'm far from perfect, but I always make an effort to make sure that, I'm kind to everybody and that I make sure everybody's heard. So, I honestly can't pinpoint any particular bad experiences that I've had.
I feel like what you had going for you is that you'd already worked with dentists as an assistant, so I suppose you could relate to nurses at some level that maybe a lot of doctors can't. Like we had this amazing intern, must have been the year before last year before I went on maternity leave, and he literally knew every single nurse's name. He knew every single patient's name. He knew all the bloody porters' names. I'm like, I don't even know all their names. And he knew everyone, and he made a point of knowing people's names, and I'm like, you know, if that's refreshing, like that's a worry.
Yeah, I know. Yeah, it is.
Some of the doctors we get now, like that are admitting GPs to our hospital, I'm sure they wouldn't know what my name is.
Yeah.
And I'm like, I run the fucking hospital.
Yeah, but that's crap. Like, that's a reflection of them, you know, like there's no reason why you shouldn't make an active effort to know the people involved in everybody's care around you, you know, like.
Exactly right.
Yeah,
particularly because I'll be the one saving their arts if a patient drops dead.
Yeah, but also like you guys, you spend a lot of the time, you spend more time with the patients one-on-one. So, you know, if you're concerned, then you genuinely have a reason to do so, and we should really acknowledge that, instead of being like, oh, whatever, you know, listen to this nurse or whatnot. That's crap. Like, you know, you're not going to show concern if you're not genuinely concerned. So yeah, I have a bit of a fundamental problem with people when they do have issues with people, you know, in different allied health areas. Yeah,
I wonder if that's your country nature coming out as well. Yeah.
Maybe. Yeah, I mean, I'm an inclusive person. Like, it takes a lot to piss me off, and it takes a lot for me to not like anyone. So, yeah.
Whereas I'm the opposite. Like, I was from the city and moved to the country, and I have like no tolerance.
That's funny.
How did you decide? Is orthopedics going to be the area that you now specialize in? Is that what you've decided?
So it is. Like, I'm not in what we call set training yet. So I'm not a dedicated orthopedic RACS trainee in a sense yet, but I am a service registrar committed to orthopedics. So yeah, that's the discipline I've gone, and that's where my love lies. So yeah.
How did you decide that was for you?
Oh, people ask me this all the time. It's actually, there isn't like one defining feature for me, but I guess when I kind of first started, you do your surgical rotations as a, med student and get, exposure to different areas. I was really lucky that I had quite a good team of people that were just really enjoyed the banter they gave one another, really enjoyed the kind of camaraderie within the group that I saw, and that really appealed to me in the first instance, I guess, from a person side of things. But the surgery itself is, I think, one of the more forgiving surgical disciplines, and in a sense I mean that every surgery has its challenges, and orthopedics is certainly a challenging one at that. But if you put a nail in the wrong spot or a screw in the wrong spot, you can take it out and put it in again and reposition it, and you can often plan ahead and think about things like that. Whereas if you're playing with someone's brain and you put something in 1 millimeter to the left, then that could be game over. So that scares me in that sense. But no, like the human body and the skeleton and the musculoskeletal system to me is kind of the most important thing, because without that we really have nothing, right? So
spoken like a true orthopedic surgeon.
Yeah, but also, I should go. We get to carry hammers and
no,
you're like, no, it's because I'll probably make a mistake, but if I do, it doesn't really matter.
No, it's just it's a creative area of surgery. We can reconstruct things, and it's like the crafty side of it, I guess.
I really liked that about ortho too. I used to work in theatre, and I only liked the really little ortho stuff. I wasn't interested in doing joints and stuff. I just wanted to do like little orifices on fingers and stuff because it was kind of fun.
Yeah, absolutely. Yeah.
I worked in operating theatre as well, and I was on call and got called in for a patient that had a hip done, and they fractured I don't even know what the bone is, the femur. Anyway, and the nurse that I was on with, she's like, you scrub because I know where everything is. Like, I'm ortho trained. I was like, I don't want to scrub. I don't want to do this. I don't like it. And the orthopedic surgeon was like, you're going to have to push on the leg. We need to pop it out. And anyway, when it popped out, I almost vomited in my helmet. I was like, oh, that's the worst. And he's like, are you going to survive? I was like, I don't think so.
Oh, that's funny. I like
Bones
that.
Are gross. What's your favorite surgery? Like, what's your favorite, most interesting surgery that you've been part of or that you love to do?
Yeah, I guess the most interesting one I've been involved with, at the moment I'm working with the bone tumor unit, so we get to do some pretty cool reconstructive type procedures. There is this one that we've done where basically I'll kind of summarize it in simplistic terms, but basically you take the tumor out of someone's tibia, so one of the bones in the lower leg, and we used a humerus from a cadaver that we then used part of their fibula on the same side and spun that around into the cadaver humerus and kind of plumbed it back in like a bone hot dog. It's called a Kapana technique. It's a really cool thing, and it takes 12 hours this surgery. It's an all-day event, but to do that is like to salvage someone's limb instead of having to traditionally amputate. So that stuff is really, really cool. The reconstructive options we have, especially in pediatric cases where traditionally, for bone tumors, they'd have to just lose a limb. So that stuff's probably the coolest stuff I've been involved in.
Do they use a lot of 3D printing and that kind of thing?
Yeah, we use it occasionally to operative plan. We don't use it as much for custom implants and so forth, but you can. Yeah, we tend to just use more off-shelf stuff if needed. But yeah, no, it's pretty cool stuff we can do. It's pretty cool stuff. Yeah,
I could see why you'd be interested. I guess the stuff. I mean, because I worked at one of the tertiary hospitals up here, but we only had 3 theaters, and we'd fit emergency cases in between, so we weren't doing massive stuff. I think the biggest surgery we did were we didn't have neuro or anything like that. We it was pretty much ortho, general, and gynae. I guess I haven't seen a lot of the great big things that they're doing.
I mean, this stuff's not common, this stuff's definitely not common, but yeah, trauma stuff's really cool as well. I like being able to kind of, just think on your feet and, damage control type surgery stuff. That's cool.
Nurses are going through a really difficult time right now, and we get that finding time to go to therapy while working shift work can be even harder. This is why we're sponsored by BetterHelp.
BetterHelp has customized online therapy that offers video, phone, and live chat sessions with your therapist, so you don't have to see anyone on camera if you don't want to. You can use BetterHelp at a time that suits you, in a format that works for you and that fits in with your schedule. There's a huge range of expertise in BetterHelp's 20,000 plus therapists network, so help is accessible to you no matter where you are.
You just fill out the questionnaire to help assess your specific needs, and then you get matched with a therapist in under 48 hours. Then you can schedule secure video and phone sessions, plus you can exchange unlimited messages, and everything you share is completely confidential. You can request a new therapist at no additional charge at any time.
Join the 2 million people who've taken care of their mental health with BetterHelp. Get 10% off your first month at betterhelp.com/2HN. That's betterhelp.com/2HN. That's the number 2HN.
Oh, and again, Kelly's favourite question. Kelly had to keep this question in, and I was like, really, is it even necessary?
Okay.
She's built it up now, but what's your favourite bone and why?
Oh, okay. All right. Favourite bone, probably the femur. It's the strongest bone. It's the longest bone. And it's the bone we operate on the most, probably. So the one I'm most familiar with. It's my fave. It's a good bone. I mean, every bone is great. There's 206 of them. I like them all.
Kelly, what's your favourite bone? I'm curious now.
Oh, I didn't really think about an answer for it. I don't like bones. I feel like the skull's pretty cool because, it protects your brain. And I've seen people whose skulls just crush for no reason at all, really. And then other people's whose skull they can smack their head so hard and then they just shake it off like nothing's happened. And I'm like, how did that happen? Plus, I've used skull brain. Oh, no, I personally use it, obviously. Skull bone to reconstruct a nose in surgery. So I dropped it on the floor. The surgeon handed it to me and I dropped it.
Oh, he or she would have been so mad.
He was like, get a bowl of betadine, put some antibiotics in it, and just soak it. And I soaked it in peroxide, and then we just used it. Yeah,
yeah. We call that the med student special or the registrar special, because normally it's a junior surgeon or a medical student that does that.
That's funny.
Oh, dear. That's good.
I'm curious, actually, are there any surgeries that you hate doing or that you don't want to be a part of?
Not really. I mean, at my level, I'm like a sponge, so everything I see and do is exciting to me, and I'm, learning every day. So nothing so far that I do not like in particular. orthopedic wise, of course,
Yeah.
If they threw me in and made me do something that wasn't bones, I'd be like, no.
Go and do an anterior vaginal repair.
Yeah, no, look, not for me.
I don't think they're for anybody. Right.
No.
Obviously, as females in the industry as well, we can get a bit of like bias against us. But you are also very heavily tattooed and very multicolored in your hair, and you've got piercings. Has that affected your medical career in any way so far, do you think?
Look, I can't directly pinpoint any areas that it has, but I guess the hardest thing is a lot of the applications, there's not a lot of transparency, so you never really know truly if it is affecting you. But I've been really lucky, like so far, the jobs I've applied for, I've been able to get positions for. I've always interviewed well. I've always had really supportive mentors that know that I am who I am and I'm unapologetically who I am, and they support that. So I don't know whether I've just been particularly lucky or not, but I think for me, I'm a hard worker, I'm caring, I always go above and beyond, so maybe or hopefully that people just let my work speak for itself. So
yeah, I've got quite a few tattoos too, and I don't think it's ever affected my nursing career at all. I'm a nurse unit manager now.
Makes you more interesting to your patients.
Yeah, I don't even see, I forget I have them, even though they're all over my arms. And patients will say something, and I'm like one patient the other day asked me about avocados, and I was like, oh, yeah, I like eating them. And she's like, oh no, you've got an avocado tattooed on you. So I thought it must have meant something. And I was like, oh, okay, no worries. Avocado.
Yeah, same for me. I always forget too. And then, occasionally someone will bring something up, or it'll be a conversation starter. And I'm like, oh, that's right. Yes, I do have rainbow hair, and I'm wearing, an all pink outfit or whatever.
Yeah.
I'm pretty sure I was discriminated against when I went for my grad year at the Royal Children's, because I was the only person not wearing a suit. I wore really nice black jeans with this gorgeous blouse, and everyone else was in skirt suits. I'm like, what the fuck? I didn't get that in there. I swear, I made the top 100, and they only take 50. And I'm determined that was the only thing that would have separated me from everybody else in the room.
Screw them.
Discrimination.
Yeah.
How have you been treated as a female in a mostly male industry? I mean, especially I don't know what the ratio is between male and female identifying doctors. I'm guessing it weighs heavily on the male side. And then also in ortho, I mean, of all the orthos I've worked with, I think I've never worked with a female ortho consultant.
Yeah, I think the numbers I think at last check for female orthopedic consultants is 3.3% compared to men. So it's, we're still quite the minority, but that's consultancy. I mean, at a training level, it's certainly improving, but improving slowly. And by slowly, I mean still way behind where it should be. Look, to be honest, again, I'm a pretty strong personality. It takes a bit to rock me. So I've been pretty lucky. But I certainly do know of other female colleagues, in particular, at the orthopedic level, that found it harder. If you're not quite a vocal person, it can be quite easy to be, I guess, to be kind of hidden away in the shadows in a sense. Sometimes, I walk into a room with my, interns on the team that are, male colleagues, and, often people will just be like, oh, assuming that he's the surgeon and I'm not.
Yeah.
So, that still happens. I think that kind of unconscious bias towards us being women. That still certainly does happen. All things like, you can only ever get an extra long, extra large gown in theatre. I can never get a freaking gown that fits me. I'm always tripping over it, or I can never get to the height of the table. But no, it's slowly changing. And look, Orthopedics Australia is certainly trying to get more women in, but it's certainly still behind, and we certainly do still get unconsciously kind of discriminated against without people realizing it. It's certainly still there.
Yeah, absolutely.
Yeah,
I think it's the same in the nursing world too. People expect women to be nurses, and men to be doctors. So if you walk in with one of your nursing colleagues, even if you're dressed in the same uniform, they just assume they're the doctor, or
one of the male nurses
crazy.
at our work just wears a polo shirt and everybody thinks he's a doctor. I'm like, you're not a doctor.
That's funny. Oh, okay. I asked you what your favorite bone was.
Yep.
Do you have a favorite tattoo?
Favorite tattoo. Got many. Lots that kind of mean different things, different points in my life that are quite hilarious, which people won't really understand, but I'm sure you ladies will appreciate them. So I'll tell you them. I've got a Nicolas Cage from Con Air.
Oh, no.
Yeah. Oh, my God, it's one of my favorite movies.
One of my favorite movies is just him with the hair blowing in the wind, Cameron Poe enjoying life. Got one of those. That's a good one.
Brilliant.
I've got a little Dr. Nick Riviera from The Simpsons where it says, tell me what, and I'll cut below, which I got when I got into surgical. I got my first surgical job as a resident, so I got one of them to commemorate that. What other fun ones have I got?
That's great.
So many. I've got a party raptor, like a velociraptor drinking a Tom Collins.
Oh. What was the first tattoo you ever got?
I got like a little tiny rose on my hip when I was like 16 years old that I picked off the wall in a tattoo shop telling him I was 25.
Yeah. Oh, you really went big. 16
Yeah, went big or go
I was 17 and it was 1995 and tattoos were not a thing. And I walked into this dodgy tattoo parlor by myself.
Yeah.
And he smoked a joint and asked me if I wanted some, and I was like, nah, she's right. And then I got a dolphin tattooed on my boob.
Yeah.
Thank God it's low enough that you can't see it when I wear a low cut top. But I was just like, all my friends were like, what the fuck, Kelly? But I was like, it's 1995 tattoo, like dolphin. Like it's but it's terrible.
I feel like between the three of us, we are each a cliche because I have a bird on my back and it was my only tattoo and I got it when I was 18, like as a present from my best friend.
I love that.
3 cliches.
That's all right. We can be 3 cliches. 3 peas in a pod.
Do you feel like that people assume that you're unprofessional? Like, what's like the first impression that people get of you? Do you think, or like, are people surprised that you're a good doctor?
Look, I don't know. Like again, you never really know what people talk about you behind closed doors. But to my face, like I get pretty good responses. People are sometimes, be like, oh, shit, you're okay. You are my doctor. Like, they're a bit taken aback in the first instance. But once I start talking to them, they kind of understand and are happy and accepting.
And I mean, you're freaking stunning. So like anyone will be like, oh, you're my doctor. Okay.
Stop, you guys. Too kind. Trust me, I don't look like that in scrubs.
No, nobody does. Unless you're Meredith Grey.
Yeah, I know, right?
Oh, do you get any jokes about your surname?
I do, yes. More often than not, it's like, Dr. Gray. Like, here we go again. Yeah, no, it's fine. Look, I'm an open book. If people ask me about them, I'm happy to talk about it. It's rare that someone, really says anything that they're not happy about straight away. And I mean, like, I work majority of the time in the public system. I do a little bit of work privately as well. But people should just be thankful that they're getting healthcare. If they're worried or have more to say about what their doctor looks like than anything else, then maybe they just need to check themselves.
Exactly.
And just be thankful that you've got someone that's offering support and trying to be there to help you, not turn us away because we don't look we look a certain way. Like, that's just ridiculous. I get quite passionate about advocating for tattooed people in all workplaces because the fact that bias is still there is crazy, and it needs to go, and people need to realize that just because you look a certain way doesn't mean you can or can't be competent at something based on your appearance. So
absolutely, amen.
And it's one of those unconscious bias that you have because even as a fairly heavily tattooed person, I still will look at some tattooed people and be like, oh, like still have those internal.
Like, that's a lot.
Yeah. even though I suppose, especially when it comes to face and things like, I mean, I would love, I don't know. It's interesting that you have
you
that.
wanted to get a tattoo.
Yeah, and I was literally about to say I would love to get. I really want to get one on the side of my face, but I'm not brave enough.
Yeah,
but
I'd pay good money to see that.
I'd like to get one.
Hey,
on my ears.
I own a studio. I can make that happen.
Oh, yeah. I was going to ask, how did you get involved in now you own a business? How the fuck do you own a business and work like 100 hours a week? I don't know.
Yeah, look, I don't sleep a lot. No, look, I I'm lucky. I've got my crew at the studio are very, they basically manage themselves. They do a really good job of that. So just having supportive people around me helps. It's kind of stumbled into the tattooing scene when I was younger, when I started collecting a lot, and that's how I met my husband, and that's how we then decided to open a tattoo studio. I wanted to create a safe space. As you know, being, when you get tattoos, sometimes, like you mentioned before, you walk into that, kind of scary shop where, people, you're like, oh no, this is going to be run by bikies, and people think that, which is crap these days. So I just wanted to create an area that was safe for people, and they could come and know that they're getting, clean environment, good artists, somewhere they can feel comfortable. So that's part of the reason why I kind of got into it and went out and created the studio, I guess.
That's amazing.
Yeah, I love that.
I feel like, and you have a toddler, I feel like I need to lift my game. I'm like whinging how much time the podcast and working 2 days a week is.
Stop. No, but I do have a very supportive nanny as well, because without a nanny, my life would not be possible. My nanny Danielle is literally like my guardian angel. She is just, I would be lost without her. Because you're right, having a toddler and doing all of this is somewhat poses challenges at times, you could say. That's right. Do what I can imagine.
No, you're doing great.
Yeah,
thank you.
Honestly,
arriving.
Inspirational.
Yeah, I love it.
Thanks, guys. You're too kind.
We have some word association for you, Sarah.
Oh shit! Okay, mind. On the spot. All right.
This is something we've only started with our guests recently, and we feel like it gets a good giggle. So we're gonna. Okay. You just gotta go for the first thing that comes to your head. Okay.
Oh, okay.
Okay. I don't know who thought of these words. I feel like it wasn't me.
Yeah. Okay.
Boner.
Happy time.
Horn.
Honk.
Horn. Anvil.
Roadrunner.
Roadrunner.
Yeah.
Nurse.
Handbag.
I said nurse, not pet.
Oh, they said pet. Oh, good. Superhero.
Oh, I like it.
Yeah.
God.
Good. Devil.
I thought you were going to say fake. That's good. Needle.
Syringe.
Coffee.
Life.
Pumpkin.
Halloween.
Gun.
Americans get their shit together.
I love it.
Ghoul.
Horror.
Oh, thank you so much for having a chat with us today.
So much pressure. You're
Dr.
welcome.
Gray.
No, please call me Sarah. I get weird when people call me doctor. But
we love to see women breaking the bias and just excelling. Well, I feel like you're excelling in fucking 50 areas. Leisha, I need to write something down, take some notes.
I'll stop.
You can follow Sarah on Instagram at rosesare_23. And you can follow us at Two Humorous Nurses Podcast.
Don't forget to give us a 5-star review wherever you listen to your podcast, and send us an email to hello@twohumorousnurses.com. That's humorous like the bone, HUMERUS. Bye.
Bye.